Thank you for joining us today at our Catalyzing Communities Learning Collaborative Keynote presentation. We're excited to have Angela Odoms-Young presenting. I'm Chris Economos, and I'm going to tell you more about her in a moment. But first, a little housekeeping. We'll have time to answer a few questions after Dr. Odoms-Young presentation, so please feel free to post your questions using the Q&A button on your Zoom screen. We're recording today's presentation and we'll post it on our website as soon as possible. And at the end of this event, we've got a short Qualtrics survey that we hope you'll fill out to give us feedback and help us plan for future events. Thank you. Now it's my pleasure to introduce Dr. Angela Odoms-Young, an associate professor and director of the Food and Nutrition Education in Communities program and New York State Expanded Food and Nutrition Education Program. In 2021, she joined the Cornell faculty after spending 13 years at University of Illinois at Chicago in the Department of Kinesiology and Nutrition. Dr. Odoms-Young's research explores the social and structural determinants of dietary behaviors and related health outcomes in low-income populations and Black, Indigenous, and people of color. Her work also centers on developing culturally responsive programs and policies that promote health equity, food justice, and community resilience. She has served on numerous advisory committees and boards, including the National Academies of Sciences, Engineering and Medicine, Food and Nutrition Board, and committees to develop the nutrition standards for the National School Lunch Program, School Breakfast Program, and to revise the food packages provided in the Supplemental Program for Women, Infants, and Children, or WIC. She's also been the recipient of awards, including the Mary C. Egan and Excellence in Dietary Guidance Award from the American Public Health Association and Nutrition Section at the Excalibur Award for Teaching Excellence in the College of Applied Health Sciences at the University of Illinois at Chicago. And I've had the pleasure of working with her recently, and I know you're going to be in for a big treat today. Her presentation is titled Structural Oppression as a Key Driver of Food and Nutrition Insecurity, Implications for Policy and Programmatic Interventions to Promote Equity and Justice. Welcome and thank you, Dr. Odoms-Young.
Thank you so much, Chris. And thank you, Katrina and Julie, for the invitation to present for the Catalyzing Communities Learning Collaborative. I'm very excited about being here just to share my thoughts about the role of structural oppression in nutrition and diet and where we need to go from here as we think about intervention strategies that include more structural factors in addition to some of the more proximal factors that we've explored for many years. So I'm just going to share my slides and hopefully everybody can see that. So as Chris mentioned, I'm going to talk about structural oppression as a key driver of food and nutrition insecurity, implications for policy and programmatic interventions to promote equity and justice. And I'm an associate professor in the Division of Nutritional Sciences at Cornell. Cornell sits on the traditional homelands of the Gayakono, also known as the Cayuga Nation, and the Gayakono are members of the Haudenosaunee Confederacy. It's important when we think about where we're going, as we talk about structural oppression, to understand where we've been. Of course, these communities, indigenous communities, are very active and present, but have been significantly impacted by colonization. It's not a thing of the past. And as we think about strategies, we have to understand this historical context as we talk and we think more about what do we do? And I have a few examples of that. As we go through, we'll highlight some examples, particularly from the African-American community, which is where much of my work is focused. So by the end of the session, participants will be able to describe diet-related disparities and inequities that contribute to excess death in Black, Indigenous people of color across the life course, how structural violence, so structural oppression is structural violence, and how this lens can be applied to understanding and also intervening. And then to think more about how do we address structural oppression in the context of our interventions, particularly as we think about people with a lived experience at the center of that. So we all know that suboptimal diets is the leading cause of poor death in the US and globally, particularly obesity, diabetes, when we think about the US context, cardiovascular disease, and diet-related cancers. There was a recent study that indicated that dietary factors account for more than 650,000 deaths per year and about 14% of all disability adjusted life years lost. And dietary inequities are associated with numerous health, economic, and social costs. When we look globally, although I'm going to talk a lot about the United States context, but really this is across the world. Indigenous populations and people of African descent, so African American, Afro-Caribbean, Afro-Latinx, and Black Canadians have continued to disproportionately bear the burden of ill health. In the United States, we see this same pattern. Blacks have higher death rates from heart disease as compared to other racial and ethnic groups. More than 40% of Black men and women are diagnosed with hypertension. 80% of Black women are classified using the traditional definition of overweight and obese. Black Americans have the highest mortality rate than any other racial and ethnic groups for all cancers combined, and most major cancers, 2.3 times the infant mortality rates, and 4 times infants are likely to die from complications related to low birth weight. So we've seen a lot of this with COVID. It's been significantly highlighted in the media and in the academic literature about how these long-standing systemic health and social inequities have contributed to this disproportionate burden of COVID in communities of color. So this is just a chart from the CDC, and we know that COVID and the impact of COVID continues, but as compared to overall, you see elevated or excess risk when it comes to cases, excess hospitalizations across the board when you look at communities of color, and excess deaths in Indigenous populations, American Indian and Alaska Native. You see 1.4 times higher, Black populations 2.1 times higher, and Latinx populations 1.1 times higher. In COVID, where we saw some gains when it comes to life expectancy, we see a reduction in 2020 in life expectancy that disproportionately impacts Black and Latinx populations. And it's important when we think about diet, we have to think about diet in the context of this sort of broader perspective, how it contributes, but then also how behaviors can be impacted. So how it contributes to risk, but also how all of these other factors can impact dietary behaviors. So traditionally, we think about choice, can a person choose the hamburger or the vegetables? It's their motivation. It really is a very individually focused endeavor or family focused endeavor where people make a choice. But if you understand context, we've been looking at this idea of the individual, but really it's not that we're looking in the wrong place, but we need to understand these broader issues. As this cartoon, why is he looking at risk factors and behaviors? when the key lies in the social determinants. And so the idea that the context where people live, the structural factors, the power and the privilege that they have, and how that's shaped by society can impact diet. So this is a bar high model. Traditionally, a lot of our work has been downstream. So understanding risk behaviors, looking at individual health education, healthcare interventions, case management. But just now are we starting to really move further upstream to think more about community capacity building? How do we make sure that as we look at intervention strategies, that those intervention strategies are rooted in the community and that the community has capacity to address their own issues and not necessarily have to have always external intervention. Community organizing, civic engagement. So how do we partner to build this capacity and think more about the best strategies from both academia and community coming together? Strategic partnerships and advocacy. So corporations, businesses, so community shape factors, but also broader systems and structures that are rooted in class, race or racism, how it relates to immigration status, gender, sexual orientation. And so all of these factors matter when it comes to thinking about social inequities. So what is structural oppression? So if we think about upstream, oppression becomes a big part of that context. So structural oppression or systemic oppression are forms of oppression that are deeply embedded in systems. So laws, written and unwritten policies, entrenched practices, beliefs that produce, condone, or perpetuate widespread unfair treatment. Many times we think about personally mediated oppression or personally mediated racism, but within the context of the US and in broader global systems, we see that oppression that's structural is embedded within policies and laws. And so an example of that is something like systemic racism where policies have shaped racial segregation, unfair lending practices, barriers to home ownership and wealth accumulation, issues around education, environmental justice, voting. So a lot of times people say, well, what does this have to do with diet? How do these factors relate to diet? And so part of it is, again, thinking more about not that individual choice. Do I pick the apple or do I pick the fruits and vegetables? But the idea that it is like where you drop a pebble into the water, you see these different rings, that these different layers that play a role in structural oppression at that top or external layer is playing a role in shaping a lot of the factors, whether people have access or not, whether they can choose or not, what are their life chances or not. So why should we understand the relationship between structural oppression, diet, and health? Diet is more than nutrients. So dietary practices and food consumption behaviors happen in bodies that have been impacted by oppression. And this can play a role in disease states. A lot of people have started to look at this with stress and trauma, historical, social, and physical, and marketing contexts in which people acquire food, and the economic costs of acquisition that goes along with that is shaped by structural oppression. Individual and community capacity, economic resources. Do I have money, education, knowledge, skills? And then food identity and culture, whether someone is able to access their culture or cultural capital plays a big role when it comes to structural oppression, because a lot of structural oppression is linked to suppressing traditional cultures, or not allowing people to be able to practice, or loss of traditional cultures when it comes to food production preservation, preparation, and presentation. So one conceptualization of structural oppression is to think about food and nutrition insecurity and diet as violence. The World Health Organization in the World Report on Violence and Health define violence as an intentional use of force or power, threatened or actual, against oneself, another person, or against a group or community that either results in or has high likelihood of resulting in injury, death, psychological harm, maldevelopment, or deprivation. And if we think about the idea, particularly in the context of this concept of structural violence that was presented by Johann Galton in his triangle of violence, direct violence is something that we see. So we see negative diets, we see high rates of food insecurity, but structural violence really highlights the negative consequences of the uneven distribution of power and resources, and it seeks to understand how it can impact people from meeting their basic needs. So this idea of diet resulting in significant harm. If we look at the rates and understand the rates of diet, maldevelopment, infant mortality, when we look at food insecurity, poor health outcomes, all of these things can be conceptualized as violence or direct violence, the violence that we see. Underlying is structural violence. It's a form of violence in social structures, and structural oppression is part of this, where it prevents people from meeting their basic needs. So again, if we think about violence similar to diet, we have focused on this individual level, person to person, versus the idea of the collective within structures, economic exploitation, repression. So the idea of these policies and laws within societal structures can play a role. So what do we see? We see food insecurity, as I talked about. We see obesity, we see death and disability, we see communities where you have disinvestment and extraction, disconnection from services, but these are all rooted in structural violence, policies, historic policies that have happened over time that play a role in shaping people's and communities' diets, particularly dietary disparities. And then cultural violence, where we have more frameworks and hypotheses about who are in these communities and what is their capacity, dehumanization and narratives of ignorance and inferiority. So again, direct violence. And what's really important about this is that our interventions have been less than robust and impactful. We've made some gains, but long scale population-based gains to close gaps have been limited. And this is an example of this. Diabetes Care for Blacks. This was from 2016, the National Healthcare Quality and Disparities Report, chart book on healthcare for Blacks, where we see disparities staying the same or that are worse or no change when we look at both care and outcomes. Again, food insecurity status. We talk a lot about food insecurity status. And in 2020, although food insecurity stayed stable for much of the population, we see the gaps widen. And this has persisted over time. The story is not new with COVID. So over time, we see this again, rates of food insecurity. This is from 2008, that are double. And you see similar rates for other populations of color as well. where you see this persistent gap that exists. So, and I think this is really important because this gap is more than just what's on paper. It's more than a statistic. It's cyclical. So if we have uh, these gaps that continue to persist, then they continue also again to become part of those structures in other contexts where they disadvantage people. So we think about the physiological factors like that are associated with food insecurity, like reduced food intake. But food insecurity is more than that. It's psychological, it's social, it's a managed process where it can limit people's access to better health and well-being and also economic viability. Because if they're worried about food and that they're going to run out of food and not have money to buy more, social exclusion reduces social capital. Dealing with a managed process that can impact bandwidth, it can also, one thing can impact the other, where it can limit people's ability to engage and also to thrive. So structural violence historically has, has really played itself out in several examples. And again, as I mentioned, I'm going to talk about the African American community because that's where my work is centered. But it's not only the African American community, it's broader, because structural oppression is a broader concept that looks not only at race, but gender and other factors. But for this example, I'm going to talk a little bit about racism in the context of African Americans, but it is an example because structural racism in one form is actually, structural oppression in one form is structural oppression in all forms. They're all related. So if we think about racism as a form of structural oppression and structural violence, we see again these systems, and this is from Kamar Jones, that talks about these levels of racism. But we have these systems that play a role, and those systems can impact everything below. So as we think about personally mediated racism and experiences, or internalized racism, all of those become impacted by structural racism. And so if we talk about structural racism and structural oppression, again, racism is just one form, as I mentioned, but the idea that privilege and power in the context of structural oppression are all part of a broader context, and conceptually a part of the same factors: discrimination, social power, and privilege. So we see things on the surface, but we see several things under that surface. So part of the idea is that we see things that are acceptable when it comes to diet, but we also see this idea that what we see is not always what's underlying or the drivers of it. And I love this when you think about sort of the base of the pyramid. The base of the pyramid is really those factors that are drivers, that are key drivers of what we see in all contexts. So the National Academy of Sciences published a report in 2017, and they talked about two pathways by which racial discrimination and other forms of structural oppression can impact health outcomes. So differential treatment on the basis of race. So true racial discrimination, disparate treatment, where people are treated differently. And historically, we know that these types of policies have played a role in blocking educational opportunities, employment opportunities. but then also treatment on the basis of inadequately justified factors other than race. So if we have differential treatment where people are overrepresented in certain populations, like incarceration or mass incarceration, those factors that discriminate on the basis of that overrepresentation also can have an impact on disparities. So I want to get a little bit more concrete and make sure we have time for a discussion and talk about three factors, really highlighting the first two, neighborhood disadvantage and income inequality. So this idea of structural oppression and structural violence, denying people goods and resources, creating poor living conditions, and then also looking at psychological distress. So, oh, you know what? And I realized there might be questions in the chat. Oh, okay. So there will be some time for Q&A, I know, at the end, but if you have questions, you can go ahead and stick them in the chat. So part of this is massive. These are systems. Again, the system of the transatlantic slave trade. And this is historical. If you think about the idea of almost 300 years, and then after that, so nearly more years of being oppressed than actually legally having equal rights. So the Civil Rights Act of 1964. So, and this is massive. And so part of, if we look at this history of oppression, slavery, Jim Crow, and this isn't only in the US, this was globally. So we always kind of focus on thinking about slavery in the US, but a significant amount of the population of African descent in the African diaspora is in Brazil or the Caribbean. Even within Europe, we have to understand sort of how massive some of these systems, and slavery is a system. It's not a few people making a decision about discriminating against the population. It's a system of oppression that's rooted in structural oppression. That, of course, has an impact on what happens today. So if you look at people treated as property, treated as second-class citizens, and then now living with structural racism, the history of this, the period of this becomes really important, because we can't think that it did not have some impact on all forms of health outcomes just because of the sheer length of time that existed. Including displacement of traditional foodways. A history of food as oppression during slavery, which slave narratives play an important role in highlighting about how food was used as a form of oppression and discrimination within this system of slavery. And again, we have to think about these as systems, not as individuals behaving badly. So several factors can link to diet if we look at just this example of slavery. One is geographic distribution, where people were concentrated in the South in a time where you had a lot of economic disadvantage, discrimination in hiring of Black workers, actual violence of Black workers being prevented from engaging in the labor market, disenfranchisement and voter intimidation, so lack of political power, and then also federal housing policy that links to wealth. And so we see a lot of gaps when it comes to wealth today. Black land loss, and this has been highlighted in several publications about the sheer number of land loss and growing practices and control of individual and family related agriculture. And a lot of the farms surprisingly disappeared from 1950 to 1969. This is not new. A lot of times we think about, since George Floyd, the discussion about structural violence and structural oppression as a new concept. But several reports, previous reports, including the 1985 Heckler report, which was the first report to highlight disparities as it relates to minority health, the Kerner report in 1968, emphasized a lot of the same factors, including poor food environments and lack of access to health promoting resources. And so I want to give a few examples, and I may actually end early because, of course, I always have 100 slides that I could share. But a good example of this is the ghetto grocery studies in the 1960s and 1970s in the marketing literature, similar to the discussion around food deserts and food swamps and food apartheid. Now we see the same discussion in the 1960s and 1970s. There was even a US Congress House Committee on what they call consumer problems of the poor, supermarket operations in low-income areas. So this is what happened after, some of you may be familiar, in 1992 with the issue of Rodney King and the civil unrest on stores because of the relationship that stores had with the community. Same, this is from 1968, after the murder of Martin Luther King, again, highlighting this issue of the lack of food retail in communities and how during civil unrest, stores became the target of this landscape. And again, rooted in poverty, segregation. This was published in the Washington Post in 1918. We still see the same when it comes to this context. Again, we talk about the murder of George Floyd, but it is in the context of structural violence, of the idea of the food environment, corner stores, and the complex relationship that residents have with stores. And this has been the highlight of several cases over the last few years. The Ferguson, again, corner stores at the center of that, corner stores. So a lot of times we don't think about the food environment as being part of this intersection between traditional thinking around violence and structural violence. And these were pictures that I took after, in Chicago, after or during the civil unrest, after the murder of George Floyd. Again, we see this where context matters. So a part of this context also links to wealth. And if food costs money, and we're particularly seeing the impact of that with inflation. In 2019, the median income of Black households was about $24,000 as compared to $189,000 for white households. And you see this gap actually widen with aging. And particularly, people have talked about the lack of income and loss of income that is related to COVID. And so that these gaps will continue to widen for years to come. Lastly, I'd like to talk about cultural violence. So structural violence and cultural violence reinforce each other. And so cultural violence is used to define and reinforce the legitimacy of structural violence in all forms. Unlike direct violence, it's not always what we see, but it's used to legitimize what we see with the idea of inferiority or anti-blank racism or discrimination. So in this case, so whether it be anti-Black racism or anti-Indigenous racism, with the idea of inferiority. And a lot of this is rooted in our science, in our practice. So part of the cultural violence narrative becomes who holds the solution and key for addressing problems with communities. We all see these pictures, not people necessarily working side by side, but the idea of external coming in with solutions versus the idea of solutions being driven internally. And this is contradictory to a lot of the history that we know, the history of science and agriculture, the first CSAs. And so part of this idea within communities and communities of color, that a lot of the focus has been on the deficit model, not on the asset model. And this links to how funding is distributed. And so it becomes reinforces that structural violence within interventions and solutions. So what is our epistemology when we start to think about solutions? Is our epistemology related to the idea that is very downstream, that communities don't have their own ways of knowing, or is it rooted in structurals? And this was an article from Lisa Bowleg about using qualitative methods to understand more about the structural and how does the structural impact individuals, communities, and societies in society. Do we believe that these inequities exist when it comes to systems and structures and that they're historic and that we need to develop interventions to really address these? Where a lot of our interventions focus on individuals, and when they focus on race, they look mostly at implicit bias or bias attitudes, for the idea that we really need to focus on the structural and think more about equity in the context of power, not just in access. So part of this idea of power is self-determination. And so people talk about food sovereignty in addition to just food access. A lot of times people have talked about food deserts, but this idea about what is the source. And so we can think more about power. So what are our intervention strategies? Do we look at just equitable access to food assistance or equitable access to income and wealth for people to purchase food? Equitable access to grocery stores, or equitable access to people having rights to produce their own food, to control what comes into their communities, and a focus on self-sufficiency. And I love this of all of the equity diagrams. So the idea that there's a tree bent, and that's inequality, unequal access to opportunities. If people are given the same ladder, there's not evenly distributed assistance. So that's equality when, I mean, it is evenly distributed, but it's not giving a person what they need. Equity is really building tools, custom tools that help address inequality. But at some point, we have to start thinking about how do we bend trees and fix systems so they offer equal access and opportunity and decision-making power for communities. So one way that I propose to do this is think more about liberation or liberatory approaches to move beyond the belief that science is neutral, to understand race is a social construct, and that part of it is that social construct allows us to think more about how structural oppression and structural violence is the driver. And so that we need to focus on social and structural determinants. And that these are intergenerational and transgenerational, that oppression can have transgenerational effects. And so we need to think more than just one generation, that we need to think long-term about how our intervention strategies play a role. And that we have intersecting identities. It's not just race, it's gender identity, it's disability. Again, all of these are part of the same factors. And are we moving towards just sameness, or are we moving towards justice? What is the end that we're working to? So part of this is acknowledging and thinking about interventions to address structural violence. If we know colonization and racism disrupted food systems, how do we highlight and think about traditional food systems in the context of reconciliation and liberation? Also, instead of having such a reductionist approach, to think broader. Insecurity is really just this idea that people have uncertainty. Structural oppression actually creates uncertainty and more than just nutrition and food. And so we need to think about not just a reductionist approach, but think broader. How can our nutrition interventions help address structural oppression and also make people feel more secure in their communities? So part of this is also digging deeper when it comes to culture. Many times our interventions focus on the surface culture, but to this restoration and reconciliation and addressing the effects of structural oppression, have to look at core values, beliefs, worldviews of communities, and look at collectivism. How can you support communities, not just individuals? And then also think about what's the start of this. And first, food equity is so important. So if we look at where do we start, this idea of human milk and human milk feeding, we see this disparity in early life. And so it's so important that our interventions start with early life. And so I'm going to stop there.
Dr. Odoms-Young, thank you so much for everything that you've shared with us so far. I know that we were asking for people to share their questions, but I understand that this kind of presentation sort of takes a minute to sink in. So while people are thinking of questions, we have one question already in the chat that I wonder if you want to tackle. Rosie Rosales is asking if there's any examples of how communities and government entities have worked together to bring change in food deserts.
Yeah, I think that's, Rosie, I think that's a great question. So if you look at and think more about this idea of what's the solution to food deserts, the big focus initially was, bringing in grocery stores. So part of the initial policies, like the Healthy Fresh Food Financing Initiative, was focused on, government entities, communities working together, community CDFIs, like community financial institutions coming in, helping fund grocery stores. But part of that is really expanding, not just looking at brick and mortar, but what are other types of solutions that people can bring, whether that be urban agriculture or looking at small retail and building capacity among small retail. So the Healthy Fresh Food Financing Initiative is a good example of that. Other local areas where government is working with communities. So for example, in Chicago here, we have a food equity council, and other cities have a food equity council. I think Baltimore also has a food equity council, and others, to really bring community partners to the table, and government, academia, nonprofits, to work together to look at solutions. And one of the focus of the Chicago Food Equity Council is to highlight BIPOC retailers to make sure that they have the capital to develop food-related businesses, training and capacity building. So there are several examples that where government and communities are starting to work together through both city policies and local policies, and being able to leverage federal dollars to do that.
Thanks so much for your answer. And I forgot to introduce myself in my excitement to start asking questions. I am Angelica Valdez Valderrama. I am a doctoral candidate at the Friedman School of Nutrition Science and Policy, and I have the large fortune of having Dr. Odoms-Young on my dissertation committee. And I'm going to be reading the questions and sort of fielding the Q&A. We already have someone confirming that they're trying to digest all this. So in the meantime, here's another question, one that I was thinking of in relation to what you were talking about earlier, which is structures, right? So we're all embedded in these structures as researchers, as members of our own communities, as members of communities where we work. So Dr. Odoms-Young, in your experience, how are the visions of communities different from the visions of researchers or the people who work there? How are these different visions colliding? Where and when do you think that they intersect? And how can we best collaborate?
Sorry, I think that is really important. I think we can best collaborate when we think about knowledge as being equitable. One of the things that I've been doing recently is looking at how, people talk about scientific racism, how science has changed over time. Our perception and our view has changed over time. A lot of times we feel that science, although we know that it's changed over time, that we feel like it's not, like it's etched in stone, that this is absolute truth. And I think it's important to think about community ways of knowing and more academic ways of knowing, and really putting those in parallel where we work together to generate the best science. So a lot of times we think about a top-down approach, but I think that that thinking can be parallel. What do community partners bring from their perspective, and what do academics bring from their perspective? Not necessarily this hierarchy of knowledge. And I say that the hierarchy has actually traditionally disadvantaged communities of color. And it's documented when you look at some of the ways that science, and again, if you look at some of the stuff, you're thinking like, this, of course, is not true. You know what I mean? Like, of course, this is not true because of what we know today. The eugenics movement, for example, we would think, oh, this seems like, who would believe this? But when we think about structures, there were whole medical schools that taught eugenics. So part of it, is really thinking about working alongside communities can generate the best science, equitable science, and can help us identify solutions, not only to address disparities, but improve population health overall.
There's another sort of structure related question in the Q&A, which is from Cara, who asks about funding streams. And she says that a lot of funding streams for nutrition related interventions may be looking for more traditional methodologies. How can we effectively connect the dots for a more significant impact?
Yeah, I think that's where academics and communities can come together. Traditionally, academics have brought interventions to communities and said, okay, well, let's sign on to my intervention. I'm going to give you an equal seat at the table. But there's also other approaches. So when we look at some of those grassroots approaches where we need to understand, they need to be tested or evaluated, refined. How can we bring some of those things that community would maybe know may work? It's like, we know that this will work, or we have a feeling that this will work. So I think another approach that we can take from an academic standpoint is take those more indigenous, community-driven identified solutions and be able to test them and look at the efficacy and figure out how we can bring them to scale, because that's important when you look at, who generates evidence, how are things funded, what's evidence-based intervention. And those things are linked to funding, as you said, maybe the focus is on very traditional types of approaches, but those traditional approaches may have limited efficacy. So if we come together and also be able to test or support some of those models that are generated from communities to solve their problems, then that's one way that we can develop evidence-based interventions from the ground up, not just from the top down.
Yeah, excellent. So Reginald wants to know, he says, or they say that they find in their communities that the owners of the food stores are not from the communities. And says, in Houston, I know of one Black-owned grocery, which happened during the pandemic. How do we get the financing to the people who live in the communities to be the owners of the stores, and how to effectively manage their own business?
So thanks for that, Reginald. And part of the idea is and I hate to keep saying structural policies. If you look at historically, it's policy that disadvantaged, that created this disadvantage when it related to Black business. And part of it, we think that these conversations are new, but again, read the Kerner report. These same things in the 1960s were still the discussion about how do we create more capital in Black communities? How do we look at more even social service organizations, better education? And so in a lot of cities, you do have primarily in Black communities, immigrant store owners, particularly of Middle Eastern descent. I'm in Chicago, although I just transitioned to Cornell. We work with an organization that is engaged in those store owners. So part of it is, it may be multiple strategies. So we work with an organization called the Inner City Muslim Action Network. They're engaging those store owners to look at more equitable business practices and ensuring that some of even the their perception of the community that they may be coming in with, that we start to change that perception and make sure that those store owners and the community can work together. So that's part of it, because in working with what is. The other part is policy. So when we talk about the lack of Black store owners nationally, or the lack of store owners that come from communities and where you don't have community, but you don't have people from the communities operating in the communities that they serve. Part of that is through policy. So as you talk about financing, how can we advocate for city policies? A lot of that is local. So in our Department of Planning, in what I talked about, the Food Equity Council, is really looking at BIPOC producers, businesses, finance, and that's a policy. Those are policies. So how do you work with your city to think about policies that can help support an increase in capital? Because it really is a capital and a scale issue. A lot of banks now are looking at investing because of this awareness about structural racism. So if you look at Citibank, Chase, these programs to support Black businesses, how can some of those programs be leveraged at this particular time to look at food retail? Because what you talk about is true in probably every major city, Baltimore, Philadelphia, Chicago, where the store owners are not from the community. And so part of it is really advocating at the city level for more programs and policies to support this.
All right, well, I think we have time for one last question. Jeremy wants to know that if you had to pick one change for BIPOC communities that would increase the health of our community, which would you choose? Nutrition and cooking education or food equity?
Well, that's a good one, because I hate to say it, and I direct a community nutrition education program. I think that really the question is it a choice? If our nutrition education is not increasing equity, then we're doing something wrong. Knowledge, we know, actually, we didn't only learn this recently. If you look at the socioecologic model, particularly the one from Yuri Bronfenbrenner, it is a multi-level model. We know multi-level. Society has always played a role, but we're understanding more about upstream and downstream. Downstream interventions do not work in isolation. So our downstream interventions have to figure out how we can address upstream problems. We cannot nutrition education ourselves out of structural oppression. We can't knowledge ourselves out of health disparities and health inequities. We have to look at leveraging those approaches with other environmental supports, policies, and system supports, where we combine them. Food equity is, so I'll pick food equity, but our nutrition education strategies have to also look at equity. So whether they be trauma informed, whether they look at wealth generation for people, we can't just educate people. We have to look at co-benefits.
Thank you.
Really have to look at co-benefits. So that's an excellent question. I love that question.
All right. Well, thank you all for being here. And thank you so much, Dr. Odoms-Young, for answering all these questions.
Great. And I want to thank both of you. This was amazing. Thank you, Angela. Thank you, Angelica. I'm so glad so many of you were able to join, and thank you. Thank you. Have a good rest of the day.